We are back with Dr. Brimage with Cone Health Urgent Care at MedCenter Mebane, talking about tips and tricks for Halloween. When it comes to what we should have trick-wise, as in like our kit trick, what types of things should we have in there to make sure that everything is good?
So a well-stocked first aid kit can actually save the day. And some of the items that I would recommend would be having adhesive bandages, but remember different sizes because you don't always have a small cut. Sometimes they're bigger, so you need a bigger bandage. Have some sterile gauze and medical tape to attach it with. Try to have some antiseptic wipes and antibiotic ointment to put on the wound as well. I would put tweezers in mine, scissors, and probably an instant cold pack because those things will help you if you start to have swelling and if something's stuck in there or you have to remove something. Always, if you're going to have an injury, especially a twisted ankle, you want to use that adhesive band, an elastic bandage, an ACE wrap, as you for other reasons. Eye wash for things that can kind of get into your eye, and then age appropriate pain relievers. Tylenol if you're younger, Motrin can be used as well for those above 6 months old. And then the other thing that I would definitely recommend is checking your expiration dates before you need them, because sometimes things run out of date and you go, oh, can I use this or not? And then that way you'll know before you actually use it.
Yeah, it's one of those things that maybe at the beginning of every month, if you can remember, that's the time to go through your kit and kind of like look at everything to see what you need. All right, let's talk about skin irritants or rashes maybe from the masks or the face paint. How do we treat them at home, and then when do we consider going somewhere if we've got something going on?
So sometimes you can have face paint on that you don't normally wear, masks that you wear for Halloween that you don't use those things every day. And if you do start to have any kind of skin irritation, be sure to wash it gently with a mild soap. Put on some fragrance-free moisturizer, and then consider a little hydrocortisone. Oh, I didn't add that one, but that would be a good thing to add to my first aid kit as well, because you would need that. The other thing is for the next couple of days, try to leave it be. Don't touch it. Just wash your face, put it on the moisturizer, and then a little hydrocortisone. But if you start to have spreading or blisters, or you feel like something's starting to swell, especially around the eye or the mouth, unfortunately, it's time to see a healthcare professional.
Okay, got it. Any safety precautions maybe that we haven't talked about, but we should be talking about when it comes to Halloween?
Definitely. So costumes are not very visible at night, so try to make yours visible. Consider adding some reflective tape or glow sticks. Watch out for cars or uneven sidewalks. You're walking around with your kids, but you're on the phone, and oh, there you go, you tripped. So be mindful when you're walking and using cell phones. Only use it when you're not distracted. Pay attention to small costumes parts because they can become a choke hazard, especially for young kids. And then keep your sidewalks clear and well lit to prevent trips and falls. And then for the drivers, you're driving through your neighborhood. That's your normal neighborhood. But Halloween can quickly become unpredictable. So you kind of got to try to expect the unexpected, as Julie Chen would used to say.
Yeah, and the kids, they're running back and forth and they're not really paying attention to the cars because they're so excited. So you really have to be on the defense there. Any final thoughts as we're wrapping things up?
Oh, remember that Halloween should be fun and full of creativity. Just with a few safety tips, you can have a really good night. Try to have the right costume that fits you well. Don't eat too much candy and enjoy your happy, healthy Halloween night.
That's right. Don't eat too much candy. That's going to be the hard part for sure. Thank you for your time and expertise. If you missed any of this, maybe you want to send it to someone, you will be able to find it in the To Your Wellbeing section of our website. Right now, we're going to take a look at the forecast.